There are two things that I feel need to change in our industry. One is we do a significant amount of research without following through on the research to create solutions that really help improve quality, affordability, and accessibility. The second thing is I believe that there are many key organizations of great strength in the industry that work in isolation and don't work in partnership. The partnership between Anthem Health Corps and Wharton Leonard Davis Institute is a good example of how two organizations of great excellence and expertise can come together to bring their assets to improve care delivery and health insurance.
Health Corps, we're a company made up of a large part in researchers. We have health economists, we have biostatisticians, we have a large group of clinicians within our organizations, a lot of individuals that are very, very heavily experienced in dealing with healthcare data in terms of getting it in, being able to effectively utilize those data.
Leonard Davis Institute is a university-wide center for health economics, health services research, and healthcare policy, and we play a role on campus to bring investigators from throughout the university together to collaborate on innovative research projects and investigations. And our vision at LDI is affordable, accessible healthcare for everyone. And it's clear from our work with Anthem that they're interested in finding solutions to those same challenges that we're quite passionate about.
The focus of the partnership is also distinctly different in that it is concentrating on the business elements and the economics of health insurance and healthcare delivery, which is specifically geared toward creating solutions that deliver better care at a lower cost.
This is not a financial partnership. This is two organizations coming together to understand the nuances and generate knowledge that was not really in existence up until now, and the hope is that this would make healthcare higher quality, more affordable, and more accessible. The data we see through looking at people's utilization of healthcare doesn't capture a lot of the business aspects. How insurance is being delivered, how is it structured, where do patients have access to and where don't they? How the network is being tiered, for example. All those dimensions are going to be really crucial for understanding individual behavior.
At Health Corps, we're working with data that comes from all of the members of the Anthem health plan, so many millions of members. And what that gives us is an ability to see patterns in the data that you cannot see with a small set of data. You need to think of it as an impressionist painting. If you stand up close to the impressionist painting, all you see is a small collection of dots. But when you step back, you're able to see the full picture.
Data is the raw material for research. It's what a researcher lives and dies for. And to some extent, I think when I started in this area, I felt like we were getting the crumbs from the table. We'd get aggregated data on national health spending or data from household surveys of small numbers of individuals. The promise with insurer-based data is information from literally millions of people and multiple millions of medical encounters that allow you to have a much richer look at the detail of what's going on, as opposed to just looking at the overall patterns of total spending or total hospital days.
All the insider knowledge exists within Anthem, and they have a lot of technical expertise working with the data, and we bring a desire for discovery for new knowledge and academic independence. And what's really exciting about this is the willingness of Anthem to, once we've decided on which projects to explore, to give us the academic independence to really explore the twists and turns and really discover, what the data are telling us.
The more academics are connected to real-world problems in healthcare and in the business of healthcare, the more they're going to be able to direct their research attention to problems that really matter, that have practical business applications, and that can influence public policy.
One that I'm particularly excited about is a project that looks at innovation in primary care. As we shift from volume-based care to value-based care. We're basically trying to change the way we provide healthcare. Instead of excelling in fixing problems, we're trying to prevent them from happening in the first place.
For too many years, the role of a health plan has been to pay the bills, to negotiate payments and perform basically an administrative function. And there are people out there that feel like that's how it should continue. But if that is our only function as a health plan, that means that we're not engaging in ways to do things better. We're not looking for things to innovate. The most successful industries in the United States are industries where they have a strong research and development department. They're continually looking for things to get better. Like, how do we make something more efficient? How do we make a product that meets people's needs? Within Anthem, we want to have the best center for innovation and the best center for development in the country.